Welcome, friends, and thank you again for tuning into the Optimal Health Program. Hope you're all doing well. As you know, today we're going to cover a lot of ground. We'll talk about the latest research. We'll talk about some of the things that we're doing in the office, a variety of different therapies, get you up to speed on some amazing info. Right off the bat, however, and I'm going to mention this throughout the whole program, because Frankie just told me on Saturday with our program on Rumble, we had 115,000 views.
Let's go.
In one show. 115,000 views from LFA live from America, which is staggering. Biggest number I think I've ever hit, ever, even on radio for all the years. So that's terrific. And if we're hitting these numbers every week, we promise to give you a great show every Monday, Friday, and also Saturday. So we're climbing.
That we are.
We're soaring like the majestic eagle. So very, very excited for that. Let's talk about some great stuff. Of course, many of my patients over all these years with STEM, we've done and treated a variety of things. As I've mentioned, Alzheimer's, arthritis, COPD, diabetes, erectile dysfunction, frailty syndrome when people are older and have become weak, heart failure, kidney failure, liver failure, lupus, MS, Parkinson's, pulmonary fibrosis, stroke, the list goes on, macular degeneration, diabetic retinopathy, and have had some wonderful and spectacular results. There's so much research ongoing now on stem cell therapy worldwide that it's phenomenal. And if you were able to go on Google Scholar, which is my favorite search engine, you could find 4 million studies on stem cell therapy and comments about virtually every disorder or disease. This is a great study looking at intravenous mesenchymal stem cell, your own cells as we do it, helping to reperfuse, reinvigorate blood flow to your heart for people that have had damage to their heart, enhances left ventricular function, is great for people that have had a heart attack because as those cells get to the area of damage, they become brand new cells to repair where the damaged cells are, improving left ventricular function, also helping to decrease the bad side effects of arrhythmia on the heart. There are also some comments in this study talking about decreasing the plaque progression and burden, and I underlined it. So they describe, and it was a very big study, multiple pages. I didn't print out 170 pages for this purpose, but critical limb ischemia, people that have horrible circulation, peripheral arterial disease. We've even injected people that have diabetic ulcers or arterial ulcers in their legs because they're not getting enough warm blood flow with all the great oxygen, vitamins, minerals, and hormones to the area skin breaks down. And STEM can help to heal that nicely, chronic ulcers. For people that have poor revascularization where they're not making the new blood vessels or what we call collateral circulation off of areas that are blocked. Advantages of stem cell for atherosclerosis, anti-inflammatory mechanism, decreasing inflammation, decreasing the uptake of cholesterol, interfering with the process that makes the atherosclerosis form in the first place, reduce mortality rates. This comment talking about decreasing cardiovascular death by 80%, providing a paracrine effect, which helps with autoimmune disorders, pretty significant and dramatic healing response, so reducing risk of stroke or heart attack. So a great deal can come from one therapy, but it's the most natural therapy that you could do. There's no drug, no side effect, no downside. They're your cells. We certainly wouldn't use someone else's cells or umbilical cord because you don't know of the origin or any of the parameters of that therapy. But I think it's important to understand that your body has phenomenal capacity to heal itself. We're just amplifying that. Of course, you want to do low-carb diet, exercise, correct vitamins, minerals, and hormones. Do that with everybody so that you can get your body stronger in many ways. So this becomes that gigantic improvement beyond the basic. Another great study on stem cell for traumatic brain injury. And we've been talking about this for a long time. I've interviewed Josh, one of my patients who was blown up in a vehicle, I think in Afghanistan. And he went from really non-functional to fully functional, physically, mentally. He graduated law school last year, and now we're working to try to get more veterans covered for stem cell therapy. So it's pretty dramatic that the same thing that can help your heart and in your any other organs will also help your brain, creating brand new brain cells where the damage exists. So traumatic brain injury is a horrible mechanism. More than 50 million people worldwide suffer from it. And the mechanism of STEM, putting new cells in, getting more neurotransmitters created, is a wonderful and a comprehensive process. Phone lines are open if you'd like to call in, 888-420, 888-420-9272, 888-420-9272. I want to thank all our people watching from Rumble, Reddit, Instagram, Facebook, TikTok, everywhere. And we love when you call in and you type in your questions. So Frankie's here. His fingers are all warmed up.
Oh, I'm ready.
Click, click, click.
So we already got a question. Someone in Reddit is asking, he said, I've heard stem cells can help. By the way, let me just say, if you're asking a question in the chat, if you'd like, it would help us out. Just let us know where you're calling from, where you're asking the questions from.
Good idea.
We assume you're from the United States. Who knows? You may not be. But
if you're not calling, you have an accent. I mean, I can't tell if you have an accent or not.
Exactly.
We had a lovely lady call from North Carolina last time. Great accent.
Great accent. And a sweetheart. Much nicer than the New Yorkers we know out here. But so, yeah, that'd be great. If you just let us know the state you're calling from, that would be awesome. But so this from Reddit says, I've heard stem cells can help regenerate tissue, but how does that work for something like a skin wound? Are they rebuilding blood vessels, nerves? What exactly is happening?
Yeah, so they can become any tissue at all. So when you put them into an area of damage or they get there, they migrate to that area, they're going to pick up on chemical messaging for degeneration, damage, and inflammation of that tissue. They become blood vessels. They become skin cells, heart cells, lung, liver, kidney, pancreas, brain cells. They make more neurotransmitters. They make more of the other hormones that are needed. As I mentioned before with heart disease and plaque, they decrease the inflammatory bad mechanism of plaque, but they're making new cells, new heart muscle cells, so you have your heart contraction coming back. So there's no tissue in your body that the stem cells can't help to repair. When we inject them around ulcers in the skin, you're growing new skin cells because you're growing new blood vessels from where the blood vessels were damaged. So if that blood vessel has to carry all the great things to the area, and because the blood vessels are damaged over time, they're not carrying it, the end of the road of those vessels, the skin and subcutaneous soft tissue starts to break down and it's not getting fed. It's like if you have a garden and there's no rain and nutrients and sun, the plants are just going to break down and die. But putting all those great things back in, because the stem cells do that, the revascularization, you get your tissue repair. And we've seen this over and over and over again in many, many ways. So yeah, great question, but that's how we're able to create repair in those areas.
And then a follow-up on Rumble. For the diabetic ulcers you mentioned, are these things covered by insurance or Medicare yet, or is it still considered experimental?
So the word experimental is pretty much of a joke as I see it, because you've had since, the late 1800s, over 160 years worth of research on stem cell therapy. Dr. Haeckel was the first to call it a stem cell because they started to see that it could become any tissue. This isn't experimental. Experimental is something that they're not sure is going to work. And there's unbelievable worldwide proof that it's worked for all these years. There are 4 million studies, a little over that, on stem cell therapy. So this is not an experiment where we don't know what's going to happen when we take your cells and put them to work. We know exactly what's going to happen in each of these areas and each of these disorders. We don't know what's going to happen if you take somebody else's cells, because if you take umbilical or amniotic fluid, your body could very well reject it because it's foreign. You don't know the genetics of that person. You don't know the infection history. You don't know how those cells were kept. How long are they frozen? How many viable cells you're getting? So that's why that's not allowed in this country. So that's a whole different category. We throw that aside. You wouldn't want to do something where there's no real understanding as to what can happen. But your own cells from your body are the greatest cells that you could ever get. I mean, anybody would agree it's a simple mechanism. Take them out, put them to where the damage is, and they do their job. You can't stop them from doing that one job that they have. So for diabetic ulcers, for diabetes, all the diseases that I mentioned, we've used it for a very long time. The majority of people will take it as a deduction from their taxes at the end of the year. Some people that have a corporation or an LLC will have that, pay for it. But as yet, the traditional realm and the insurance companies don't want it to come in and take over. And I tell people, you have to really think about how the traditional mechanism works, and you could clearly understand it over the past few years. You see what's going on. Would a surgeon want stem cells to be done for a joint and not have the surgical procedure be done? Or a doctor who's an endocrinologist, does he want to send all his patients for stem cell, an IV, which could likely help to change and reverse the diabetes? We've seen that, even in people in their 70s and such. They're not going to send patients away. As traditional medicine is its own enclosed network of, you have to do what I say. And drug companies are not going to say, yeah, let's do that. And, people get off meds. I mean, there are a lot of different ways to look at it. That's the biggest way to look at it. So, it's sort of an uphill battle because people will tell their patient, oh, there's not enough research on it. And I said 4 million studies is not enough research. All of these years, they're giving you medications that are not, 100 years old. They're giving you medications that are relatively new, and they're trying to guess to see what it's going to do for you. But then all of a sudden we find out, and more times over the years than not, oh, the side effects. Oh, look at the bad side effects. Oh, this drug's got to be pulled because there's some bad outcome or side effect to it. So a lot of medication use is guesswork. It may be somewhat research guesswork, but you don't know the antibiotic's going to work for you, or the blood pressure pill, or the cholesterol pill, or any of the other pills for that matter. They're trying and seeing what's going to occur. You have to use those things if a person comes in with crazy blood pressure and they're 180 over 100. But in the same breath, when I do that, I also change the underlying causes that we find. So it's got to be a comprehensive approach to the entire picture, not just using a pill and sending you on your way, and then a month, 2 months, 3 months later needing more and more pills because the first ones aren't working. If the first ones aren't working, why do you keep them on board? That's another thing that I have an issue with. If you put somebody on a blood pressure pill, it's not working, you use another pill, throw the first one out, get rid of it. It's not done.
That's wild. And 4 million studies, that's such an incredible, if you think about that's a number where it's not like the government's funding all this research where, oh, look.
And
it's like
thousands and thousands of clinical trials on stem cell therapy. So this is not something where people say, oh, well, maybe it's experimental, it's unapproved. There's nothing to approve. They're your cells out and back in. It's the most natural therapy you could ever do. So with your cells, the expectation is extremely high for result, and that's what we see. It's not like you're taking a drug that was never meant to be in your body,
right,
made from one thing or another thing. And even there are medications made from plants, and that's kind of theoretically maybe more natural than synthetic. But the point is, if your body's never seen it, your body may have issue with it. You can have bad side effects to medications depending upon how your body metabolizes meds. The cytochrome P450 system, among other systems in your body, are how you break down drugs into metabolites so they can work. But some of those metabolites are going to cause you problems. But it's the safest mechanism to help to repair your body because they're your cells. They're there. Take them out, put them back in.
We got a YouTube question. It says, I've had diabetes for over 20 years and my circulation is not great. Can stem cell treatment help with poor blood flow or just the wound itself?
No. I mentioned it before about revascularization, good for the lining of your blood vessels. So for the diabetic, the approach that I use, as I always use the word comprehensive. So when we sit down, I take your history, I examine you, get your big blood test done. Even at the first visit, I'll give you handouts that show you how to cut your carbs down. Low-carb diet. We give you a green sheet, which we have colorful sheets that we hand out to people, but it's a good way for us to be able to give you something that you could read that would be food substitutes. So if you like yogurt, instead of having a yogurt, it's got 30, 40 grams of sugar, you can get cashew milk yogurt, which is drinkable, 1 gram of carb, 1 gram of sugar. Put some berries in it, which are negligible, and now you have a smoothie. So you could have that. You've got your sweet taste, but you don't have the sugar. You could put a protein powder into that, mix it all up, and now you've got a smoothie with protein in it. So that's a great breakfast. You're getting 21 grams of plant protein, and the yogurt and the beneficial components of the yogurt and some of the berries. So there are ways to do things that make it easy. So low-carb diet would be one of the first recommendations. Second recommendation would be exercise. I'd have you either walk around the block every day, slow, brisk, fast. Keep changing your speed for 30 to 45 minutes. Indoor bike, exercise bike, outdoor bike, gym, Pilates, yoga, whatever you like to do. The more different things you do, your body acclimates and does better because it's seeing so many different types of workout that it's not getting used to you going for a walk down the block that's a slow pace that is not going to create enough change. So the more activity you do, the better. Correcting vitamins and hormones, because if your thyroid, DHEA, testosterone, IGF-1 or growth hormone are low, then you're not going to burn sugar and fat as well. And that also could affect your mood, memory, focus, concentration, word retrieval, muscle response to exercise. So each of these things, low carb, exercise, correcting vitamins, hormones, and then STEM is the ultimate mechanism to take your cells, put them into an IV and let them go wherever you have damage in your body. They'll go to your pancreas, set up shop, and make brand new pancreatic cells that make the insulin. So now, and we could test that. We can see if your insulin's low, and then we could recheck your insulin and your C-peptide. That's a marker of your insulin production, and watch your sugars come down as the others come up. So we can test and prove that. Of course, if you do the STEM, we have you checking your sugars somewhat frequently, and we want to watch to see your sugars continue to drop. Then we'll discuss how to cut back your medications. Even people that are on insulin, they start dropping their insulin use by, 5 units or so every day until we can see over the course of a few months that they've made a radical change and their health state and picture is dramatically different.
We have a question from YouTube. It says, hey, I'm overseas, and I would just like to know, if you're still in the chat, where overseas are you? It says, I don't think this therapy is available here yet. Is stem cell treatment for diabetic wounds mostly done in the U.S., or are other countries ahead?
I think there are a lot of European countries that have done it, and they do a lot of research. I'm not sure how you can access those things, but Germany does great research. So does Italy, France, Spain.
Hello, Madrid.
Madrid, yes. We love Madrid. Love Spanish food. Love Spanish olive oil. Hoji Blanca. So there are lots of places that have done it and do it. Japan, of course. I'm not sure what your access would be for that. I've had a lot of patients come from Europe, Spain, of course, Italy, France. Moscow is probably the furthest distance. It's interesting because I have a lot of patients that live in Brooklyn. And when people come over from other countries, like it's been going on since the beginning of America, people come into Brooklyn, spread out a little bit, and you have pockets of all these people from different backgrounds and nationalities. And they still communicate with their relatives. And I had a young lady who came in. She was a patient. She brought her dad over from Moscow. So she had to interpret. I don't speak Russian, but I've had patients from all over the place, all over the world, South America, Newark, which is like its own, country. I'm teasing all my New Jersey friends. But it's hard to understand, that's a different language too sometimes. New Jersey accent. All my friends know that I love Jersey. It's hard to say. But of course, here and, doing the podcast, what I've done on the radio for 34, 35 years, getting the word out, trying to be able to tell people what's available, what we can do, is a major part of what we talk about. So.
All right, we got another one from YouTube. Hold on, just lost it. If stem cells do help heal ulcers, how long does recovery usually take? / when can I get back to walking normally?
So it depends upon the size of the ulcer, where the ulcer is. But I think we've documented that they're going to heal 4 to 5 times, maybe a little bit faster than without doing it. Because I've seen patients that have had leg ulcers forever and bed ulcers, on the heel because they're in bed a lot if they're incapacitated. And then some of these people over the course of a few months have such significant healing and repair and growth, which never had happened before with them. They may have had these things for years. So the repair can really be very rapid.
And someone's just asking for a clarification. So this is intravenous?
So, yeah, there's intravenous, but there's this little tidbit, little twist. So, of course, we do intravenous, so it gets to all your blood vessels, goes all over the place, all your organs. But I'll also take it, and after I spray a little freezing spray, like ethyl chloride, to just chill the skin and put some ice on it, I'll inject right around the ulcer. Put it right there. So it's getting there through the blood, but I'm also putting it right around the ulceration, so it's sitting there. So if you use a whole cc of stem and put it right around the ulceration, you're putting gazillions of cells right there.
Wow.
As well as with the IV. So yeah, it's one of those 1-2 punches. It's a double.
This guy.
Yeah.
We have another one from YouTube. Says, I'm relatively healthy, but I was just wondering if anyone just gets stem cell therapy to make the aging process less painful.
Absolutely. We have probably 20% of patients that will do stem that don't have any specific horrible medical issue going on. And the story that I tell of one of my favorite patients, a lovely lady who lived to 102, her great-grandfather was John Deere, and her niece is a patient, brought her in, and she came in, she did stem cells between once and twice a year over the course of as long as I've been doing it. And she played golf into her 90s. And she was a lovely, lovely woman, beautiful woman. She would dress up as if she just stepped out of, Vogue magazine. She would wear Chanel dresses and gorgeous outfits to the office. I mean, her family was extremely well-to-do, as you might imagine. She didn't wear, like, tractor outfits or anything like that, but she was really a sweet, lovely lady. Big hug and a kiss every time she came in, but she did it once or twice a year, and she had a spectacular life. And, I can't imagine people playing golf into their 90s, but she did. And, we would chat about all the different things that she's done in her life, where she grew up, and she learned how to swim at Hotel du Cap in Antibes, which is, if anyone knows, a spectacular,
another world,
gorgeous, resort. But she was very down to earth, and she was a wonderful person. But 102 is pretty amazing.
That is wild. We got another one from Instagram. What is the recovery/rest period for a shoulder labrum stem cell treatment?
So it's not as though we're going in there, we're cutting things where you'd have to have, and I've had tons of patients that have had shoulder surgery, and they end up being in a sling for 8 weeks and then have to go to physical therapy. So that's a long-term process. For our patients that we do the MRI and we look to see, the damage, and you inject that, I just tell people don't do anything that hurts. Don't do a movement that would hurt, whether it's your shoulder, your hip, your ankle, your knee, your elbow, and allow those cells to do their job. And gradually start to do, after a few weeks, we have them do a little bit of movement, little range of motion. We can get them to physical therapy. So you got to let it take some time, but it's not as though it's like a surgical issue where you are locked down for 8 weeks and you can't move or can't do anything. It also depends upon where the issue is. Might I put you in a brace? Yeah. Might I put you in an ankle device just to hold everything in place? Yeah. So it depends upon the severity of the condition. And I say this to all stem patients. If you have liver, kidney, heart failure, well, yeah, some people have less of it than others. The sooner you find it, sooner you address it, the better, the easier, because you'll need to create less of a surge of cells to be able to get your result. If it's much more of a significant damage, it's going to take longer. So I tell people we have to watch you week to week and write down everything you see as an improvement with that area that we treated. And if it's intravenous, or intravenous and nebulizer for lung, or intravenous and nasal droplet, we want you to write down everything that you experience. We have some crazy things happening. A month ago, we did stem cells on my mom, and she's 95, and she's got sort of salt and pepper hair. The hair right above her ear on the side of her head on both sides is black. She doesn't color her hair, but the hair is dark, so it looks a little bit unusual because it was uniform salt and pepper, now it's black on the side. So you can see benefits in any part of your body. Some people that have had a variety of medical issues, Parkinson's patients, have, vivid color vision that popped up the next day or the same day that we did therapy. A gentleman blown up in a vehicle, you've seen his video. He had chronic headaches and neck pain and just a lot of bad things. And when we did the procedure, as soon as he got up off the table, after we did the nasal approach where we drip it into the nostrils so it goes back into your nasal cavity, into your brain, his headaches were dissipating and going away within that day. And then gentleman up from Canada who had the suicide headaches, the cluster headaches, and he had, brain invasive procedures. When he did it the same day and a couple of days afterwards, his headaches were going away so fast, and he hasn't had them since we did that. It's a few years ago. He's a great, great interview on the podcast here, so you can look at that on YouTube.
I'll put it up in the live chat for you guys to check out.
Yeah, he's a great guy. I speak to him a lot.
We got another question. I heard some big name athletes are going overseas for stem cell treatments. Why can't they just do it in the U.S.?
So think about the insanity of the paparazzi. Think about the insanity of privacy or no privacy here. Traditionally, athletes that are very obvious, they want to go somewhere where nobody knows what they're doing. And they sneak into a hotel somewhere, they sneak into an office, get it done, and, it's as if they're on vacation. But with the virulence of the media here and the paparazzi, they have no privacy. So that's why for years, many of them have gone, out of the country to get it done. The only unfortunate issue is that sometimes when you go out of the country, and it's similar to Mexico, Panama, Costa Rica, you're getting umbilical cord, which you don't know what you're getting. It's foreign, so your body could or would reject it. You don't know if the genetic issues, as I always mention, you don't know infection history. You don't know how many cells you're getting, how many die when it's frozen, how long is it frozen. So that's why that's not allowed here in this country. But people think that, you're getting it from a baby, it's got to be better. No. Your cells are the best because they're your cells. Your body could never reject your cells. Your body could never block them from working. They do their job because that's their only job.
And then we have a question from, I believe they just had shoulder surgery. They're asking, would stem cell help with healing, or is it something you have to start before?
Absolutely, positively. We have lots of patients that have full-blown tears. Now, the word tear, might be a little different to different people, but you could have a partial tear where there's fraying. Yeah, we would do stem cell for that right off the bat. You could have a complete tear and separation where you're not attached anymore. It's like taking your sneaker lace and cutting it, and now you have two loose ends. That happened to me in 2013 in my right shoulder, 2016 in my left shoulder. I had to have those separated supraspinatus tendon ends attached. They sewed them down like the cuff of your jeans and then put anchors in to lock them down, because without that, I wouldn't have been able to work out and do all the ridiculous things that I've done over the years, or continue to do the ridiculous things that I've done over the years.
I was going to say, isn't
and then I did stem cells. So my stem was done after reattaching that completely separated torn tendon, because without it reattaching it, I couldn't lift my arms. So totally thrilled that I was able to do that at that time. So
you had two separate soldier.
Yeah, from karate,
and you continue to go to karate every week.
Oh yeah.
So
nothing is going to hold me back.
I guess
I love working out. Weights, all the different things that I do. I love karate because I have some amazing friends that we train with, and a lot of them are very, very great athletic, high-ranking black belts. And I've had some people come to watch us spar and fight, and they're just horrified because it's a full contact class, and we're just beating and pounding and sweeping each other out and spinning kicks and all this stuff. But it's invigorating, and it's the best camaraderie I think you could have with someone who's trying to beat the crap out of you.
Yeah, I mean,
you're trying to do that. You're trying to do it back to them. But I love it, and it's invigorating. And I'd never stop.
I met a very nice man at your birthday party.
My house, yep.
And let's just say he was a bit intimidating. And then at the end of our conversation, I was like, the karate class. I'm like,
yeah.
Dr. Chris.
They're all great guys. Yep.
Fights this guy?
Oh, yeah.
I wouldn't go anywhere near this man.
Yeah. Yeah, my buddy Jeremiah's a big guy. It's not easy to fight. You can't stand there and go toe-to-toe with him because he's a big bruiser. He's 6'1". He's got to be 260-something, 70. And he knows how to fight, and he hits hard. So I've got to be able to get out of the way. Our other buddy who's there, Lance, is tall, and he can hold his leg up over your head for like a half hour. So it's extremely hard to fight him. Tom is also he's one of our Kyoshis, one of the higher ranks, and of course, Bob is our Hunchy, our instructor, and he's been teaching people for better part of 40, 50 years. So we have a great group of people, and we never miss that Tuesday night class. You just don't miss it because you love it so much. So it's a little paradoxical. You love getting, punched and kicked and swept and knocked down, but it's good.
Okay, we got a couple questions. So someone wants to know, does stem cell therapy compare to PRP or cortisone shots?
So they're worlds apart. Cortisone is just going to decrease inflammation. It'll never repair, grow, help, but you feel less discomfort and maybe your inflammation seems to come down. But cortisone injections into ligaments and tendons may be a drawback because it may make them weaker. It may allow damage. Just like, we heard years ago, not too many years ago, that certain antibiotics can damage your ligaments and tendons. So if you do a cortisone shot and you're doing activity and your injury is still there, you can make it much worse, but not really feel it as much. PRP is taking some blood, spinning it, injecting 7 growth factors into the area, but it's used up. It's gone over the course of about 3 weeks. So if it's going to give you benefit, the benefits are mild. You only use it for milder, strains and sprains, because you can't use it for, tears of ligament, tendon, cartilage, etc. And on a scale of 1 to a million, PRP is 1 and stem cells are a few million because they're colonizing and they're constantly creating that growth and repair. And then some people do PRP 3 or 4 times. By that point, you're just about at the cost of doing stem. So PRP is good, but it's limited use.
And then we have one from YouTube from Georgia. Thank you. Hey,
Georgia.
Thank you. Our first to give us
Awesome.
a location. We love it. I have Lyme disease and autoimmune issues. Is stem cell therapy being used for chronic illness, and does it actually help?
Absolutely, because you're shutting down the bad inflammatory cascade. You're also augmenting your body's ability to repair itself. Of course, we have Lyme patients that have done vitamin IVs because vitamin IVs help to quadruple your killer cells to fight things. We have them on antibiotics. We have them on nutrients, a variety of different things. So Lyme is one of those things you need to hit from a variety of different aspects. It can't be just an antibiotic and watch and see what happens. So that's why we put it all together.
I'm thinking they were visiting Montauk because I don't know. The ticks haven't made it to Georgia yet, or probably have. Who knows?
No, they're there. There are ticks and Lyme disease in every state in the union.
Is it?
And just about every country. So I was looking at research to this, and I had spoke to Dr. Boroscano a week or so ago, and we're going to interview him in the next couple of weeks.
Can't wait for that.
He is the premier doctor on Lyme disease and how to evaluate it and treat it. I'll call him today, just to kind of lock down a date for him, maybe on a Saturday, because that would be a good thing for a massive Saturday audience. And as soon as I speak to him and we kind of set that date up for a Saturday, we're going to announce it like crazy, and I'm sure we're going to get 1 million people that want to hear what he has to say. So we'll get that set up. But yeah, everything should be treated in a comprehensive fashion. Like I don't give antibiotics for a sore throat unless, we've already seen the patient work on their vitamins and minerals. And if they've got a cold, we have them do the vitamin IVs. It's interesting too, over many years of doing this, 37 years, so there are people who have a cold, a flu, they just feel run down. They'll do a couple of vitamin IVs and pop up, feel great. And making more killer cells helps you to fight the infection. So you're giving your body something to walk away with. An antibiotic is there, helps to kill something, maybe, but then it doesn't give you anything. So we've had people over all the years that felt so good with the IV. Throughout the winter, they'll do 1 or 2 vitamin IVs, a month, because in doing that, they don't get those colds anymore. They don't get that bronchitis in November or December or January, or they don't get that sore throat in September and such. So once you figure out the right recipe for the person between oral nutrients and occasionally doing some of the IVs, people can get and stay really healthy.
We don't have any questions at the moment. I'm going to skip all of the Lyme conspiracy talk in the chat.
There's a lot there. You know what? And honestly, how can I put this? 10 years ago, 15 years ago, and further back, people didn't have this understanding or knowledge of the nefarious or the bad nature of certain circumstances. But anybody who's lived through the past few years has seen the uncovering of what's done by certain entities, certain agencies, certain people. People will get up and lecture at TED conference talks talking about we need to depopulate, and if we're careful, we can curb population growth by 10 or 15%. You can see that online. It's evident. I've seen it. So there's a lot out there that it has to make even the most calm and relaxed person wonder what's going on. And we can go in and talk about U.S. aid and all of this other stuff. This money's being thrown all over the place. That's criminal. So you have to be aware, read, learn, never be satisfied with knowing enough information. Always learn more, especially with your health and the status of what's going on. So,
crazy.
That might be enough to set you going on that. There was someone who pretty much ran the response to the HIV and the AIDS crisis years ago. Strange how that guy is the same one who ran this other crisis. And there are a lot of people who despise what happened before and should despise that. So, judgment's coming.
Oh, Tony.
Yep.
I'll leave it there.
Hey. 888-420-9272 is the number if you'd like to call in or send us a lovely little note. We'd like that. If you like our program, which I hope you do, you can like and follow and subscribe or however it's done on the platforms.
Yeah. We got a question from YouTube just wondering, how many rounds of stem cell treatment does someone usually need? Is it a one and done or more like a physical therapy kind of thing?
It's pretty much one and done. It depends upon what a person has. I don't recall if we've ever done a second treatment for a diabetic. It's possible over the years, but most people, we track them, and over the course of 2 to 3 or 4 months or 5 months, these individuals are non-diabetic. So joints, I don't recall injecting joints a second time because those cells continue to divide, and it's like having offspring, occurring over time. There are people who have MS, Parkinson's, Alzheimer, and stroke that we've done second treatments on, and maybe some of them done third treatments on, but they've gotten benefits every time. So if you're in a dire circumstance with those diseases, because they're bad diseases, and you get 60, 70% benefit the first treatment, and you want to do it again a year later, you can, of course. I mean, they're your cells. There's no negative and no downside to it. Some people do it in 6 months, but it depends upon the severity of what you have.
We have someone in the chat just asking, they said, I did long-term antibiotics for Lyme, and it wrecked my gut. Is stem cell therapy a safer, more restorative option?
Stem is terrific for your gut. There's a great video on the website of a gentleman for 21 years has ulcerative colitis. And after one stem, overnight, he said his movement became much more regular and has been doing great ever since. And his life is a different life now because he was afraid to go anywhere. He thought he'd have an accident. At one point when he drove beyond, a short distance away, I guess, and he would talk about going to see his aunt and his friends. He had an accident, came in, we worked him up, did the stem, and now he's going everywhere and doing anything. So it repairs and puts new blood flow into the area. I'd also want to see what's going on with your gut, maybe do the comprehensive stool test or a microbiome test and look at correcting nutrients. Again, there's a lot more that we have to talk about, but the big blood test will cover all that.
And a follow-up from same person. They said, my worst Lyme symptoms are neurological, numbness, tingling, memory loss. Do stem cells help with nerve repair on brain inflammation?
Absolutely, positively. Once again, I'll refer you to great videos on the website of stroke, MS, and Parkinson's patients.
The website's right there.
And those people have really bad, even in a wheelchair, really bad neurologic circumstance. And you're getting new brain cells to exist because stem become new cells, and they create new neurotransmitters, which, creates that great result. And Lyme is a little bit different than MS. MS is the damage on the sheath that coats the nerve, almost like looking at the socket and you take a electric component apart and you see the white and the red and the black colored wires, and inside is the copper. But if you wear off that rubber coating, that's sort of what happens with MS. And Lyme is a little bit less severe than that in terms of that damage. But yeah, you put brand new cells into an area with damaged cells, you get great function.
That's wild. Yeah, I remember a caller saying that when we first started the show that they were, at a red light and they all of a sudden had no idea what the colors were.
Yeah.
And it was Lyme. It's
Yeah.
just terrifying.
It's scary how things can damage small tissues of your body. And we've seen people with macular degeneration and diabetic retinopathy that had great results. So your own body has amazing capacity to repair itself.
And we just have someone asking, have you ever worked with any football players?
Yes.
I don't think you could say the name.
I'll
guys.
tell you, I can tell you a story that made me really angry, but it's not a story about treating. It's a story about being, what's the right word? Not ignored, kind of like pushed back. So one of my patients, great guy, finance guy, knew the head of, I think, the players' union for the NFL. And I was able to talk to him and said, this is what we do. Give me 5 patients, 10 patients with, concussion. Let's do STEM. And I showed him all the videos on traumatic brain injury from the veteran about stroke and MS and Parkinson's. He says, well, what do you want? I said, just give me 5 patients. I'll treat them, without charging anybody, because I want to prove to you and show you how this works. And as you can see how it works, then there should be a way that we can do something where, we could treat any and all of the guys that have the concussive disorders, because there's nothing better for that brain than to put stem cells in and make brand new cells where those cells are damaged. He sent me to, I'm not sure if it was the number 2 guy or 3 guy in the league, who was an attorney, and he came back to me and said, I think what you're doing is amazing. I said, well, thank you. He says, but if we agree to do this, then we're taking on the responsibility and we're taking on a legal aspect of this that we don't really want to take on. And I said,
I have insurance.
what are you talking about? So they didn't want to pursue this because then they would be liable, according to what he said. As if they knew about it and they knew something that would help for it and they'd never done anything for it. It's a whole big thing.
Unbelievable.
So it's odd because a lot of ball players, the teams don't let them do anything. Some will come on their own, and some will come after they retire.
That's unbelievable.
Oh, yeah.
I'm speechless. What else we got?
I didn't think there was a legal mechanism there, but apparently there is.
I bet, it's probably one of those things where it's such a small chance, but they want.
Why wouldn't you want to try something, even do it for a few of the guys to see how much better they can do, and then, create fundraisers for it, but they think that they would be liable. It would be them being sued, who knows?
That's wild.
I tried.
It's like, make better helmets or let this man help.
Yeah, even the helmets, it's like cars colliding at each other when 300-pound guys, just crack into each other and someone's running real fast and the other guy's coming up. It's just a hard hit.
Unbelievable. All right, what else we got here? I'm throwing up the number. We have not got a phone call today, so there is your number. Give us a call. Don't be shy. 888-420-9272. We are live.
Let's see. We've got some comments from patients that I took off of the website. Low back pain with some disc degeneration, no herniation, but difficulty with twisting and turning right across their low back and towards the crest of their hips, the ilium. That's usually sacroiliac. So one of the great mechanisms of STEM is to inject it into those ligaments that crisscross from the sacrum, which is this orange plasticky thing here, and the crest of the ilium, so sacroiliac. So we've done that, and it works really well. Of course, MRI has to tell us exactly what we're dealing with. Hair thinning and loss in men and women. Does biotin help? Well, it's one thing. So, yeah, of course, when your blood test shows, if your hormones are low, IGF-1 is low, your hair is going to be changed. Correcting IGF-1 improves hair growth, skin, nails, fat burning, muscle strength, a lot of things. Vitamins are critically important for your hair. Some men have a hereditary issue with hair loss, so that may not be changed by vitamins. And there are people that we've done stem cell for in their scalp for their hair to help to stimulate hair repair. So there are different things that you can do. It just depends upon how you present.
We got a question in the Rumble chat real quick. Important one, so jump in the line. I served overseas and had multiple blast exposures. I've been diagnosed with mild TBI. Can stem cell therapy help veterans like me with memory, focus, and emotional issues?
Absolutely, positively, without a doubt. So, yeah, absolutely. We've done it. So
I'm going to give you the link to the website just if you want to reach out.
Yep. Go to the website, send us a note, give us a call. We'd love to help you out. We've seen it. And I can tell everybody that wherever you have damage or degeneration, if you put the stem cells intravenously or IV with nebulizer for your lung or nasal or joint, the stem cell's job is to go there and create brand new cells. So MS, Parkinson's, Alzheimer's, stroke, TBI, it's the same organ. The stems go there and make brand new cells. So that's why the results can be dramatic. And we've had veterans we've treated before that have had, pretty significant and pretty damaging psychological ramifications and manifestations that have done extremely well. And even looking at the video with one of our patients who's blown up in a vehicle, same thing. It's a very traumatic thing. People don't realize it. You get hit by a car, you're rattled around a little bit. You get blown up in a vehicle, it's multiple concussive waves that can damage every part of your body. If it happens multiple times, then in a way, your brain is being rattled inside your skull, and there's multiple injuries and contusions that occur as a result of that. But the greatest thing for traumatic brain injury is stem cell therapy. Absolutely.
We have a mother in the chat said, my teenage son had a concussion playing soccer last fall. He's mostly recovered, but I'm worried about long-term effects. Is stem cell therapy something we could consider now? Or
absolutely. We can consider it now because you're putting cells in to create repair. You have to be careful with sports. I don't want to say nowadays, but you always have to be careful with contact sports. And, soccer is not necessarily a hardcore contact sport like hockey or football, but whenever concussions occur, you want to get brain cells back in there to create repair so that you don't have those areas continuing to lose ground.
And she's following up. She said, should I only do it if the symptoms come back?
Well, it's hard for me to understand from that concussion how much of a change there is initially and then what changes are left. There are studies you can do, SPECT scan, et cetera. There are tests you can do to see how much, change there might be within the tissue, but concussions are not great. Your brain is rattled. So if there's some continued issue there that's not getting better, that's a problem. So you want to have vibrant, brand new brain cells. How old is the child? I don't know, but you want to have the best brain cells, especially at that age, because you want to be as functional as you can mentally and physically. What happens is there's a 10-15% defect that doesn't get better. You want that to get better. You want to have that repair.
16. Just respond.
Okay. Absolutely. That would be ideal because you're putting brand new cells there to create repair where the damage occurred. We've done it.
And we have a boxer said, I've been boxing for years. I've taken a lot of hits over the years. I don't have full-blown CTE, but I know something's off. Can stem cell therapy prevent long-term damage? Absolutely,
positively. So, as I mentioned, there are brain scans you can do to get a picture, whether it's a SPECT scan, sometimes the functional MRI. DAT scans are used for Parkinson's and such, but it'll show us, the perfusion or the functionality of your brain and see how much off the norm you would be. For people that have been boxing for years and getting multiple hits, whatever age you are, you wouldn't be the same as someone the same age that never got those repeated hits in the head. So the idea is to assess it, see how much issue there is, both from your reporting to us, the changes in your ability to function, and looking at some of those tests. And yeah, the ideal thing would be to put your own brand new cells in there to create repair and gain a lot of function back.
We just have someone asking, like, what kind of results are realistic for TBI?
It depends upon the amount of wear and tear, just like a knee or a hip or a heart or a lung. But we've seen results, and look at the videos of the MS and the Parkinson's patients. They were in a wheelchair. One treatment, they were out of the wheelchair in a month. So results can be dramatic. We've seen other people where it takes longer, 6 months to 8 months, to say, wow, look at your echocardiogram. Your heart now is contracting at 50% when it was 25% before. So nothing happens overnight. For a lot of people, I'll tell them, if you shave your head today, you're not going to have a full head of hair tomorrow. But you've got to watch your symptoms and the things that you're feeling are wrong about your body every day, week to week, and month to month, so we can watch your body repair itself. You know, multiple tears in a knee will take longer than a single tear.
All right, just collecting.
Once again, 888-420-9272. drcalapai.com is the website. We should pop it up there through the whole show. Yep. And the office number at Garden City is 516-794-0404, 516-794-0404.
Oh, you guys were all over the place. Where'd you go?
We'll give you a moment to call in and ask a question.
We got some hellos. Hello, vintage gal.
Thank you for watching the show. For everyone that watches the show now and throughout the entire day, apparently we're getting a lot of people that are told about the program and watch it, later on. And I can say with our last Saturday, we had the biggest day ever. Now, I haven't been doing this for 10 years. I mean, the podcast. I haven't been doing it for 5 years. I haven't been doing it for a year. How many months are we at? 3, 4 months?
Right before January, I want to say. December, maybe?
So, yeah, 4 months or so. 5. And we had 115,000 viewers on Saturday.
Crazy.
Which is spectacular to me.
That is crazy. That was all of our weeks combined.
Live basically. From America, 115,000 views. Pretty cool.
Not too shabby, Doc.
You sound like Adam Sandler. Not too shabby.
We got some LFA lovers. LFA rocks. Yes, they do. By the way, so we're live Monday, Friday, 12:30 on, and then Saturdays, 2:30 on LFA and on all the other channels. So if you're coming from LFA, tell your brother, tell your sister, we're on 2 other days.
Coming to a computer and a TV set near you. Yeah, a lot of my patients watch it on TV because obviously they could just jump on YouTube and see the big screen. So,
right.
Let's see what else we have here. Menopausal symptoms. What should I do for hormone replacement therapy? A 39-year-old lady. And we talk about testing your blood first, vitamins, minerals, hormones. One of the first things we talk about if you have a decline in estrogen, progesterone, and we see in your blood that your LH and FSH are going up. That's what happens when you lose the production of your estrogen, progesterone from your ovaries. Your brain says, hey, what happened? I want more. So if menopause itself was a normal thing, this is a question I've bounced back and forth on for many years. If it's normal and good for you to lose those hormones, why is your brain asking for them again? Because all your cells need some of those hormones to function. There was another great article here, I got to figure out where I put it, talking about hormone decline and menopause and high blood pressure, because typically what happens is as the estrogen goes away, circumstances change and your pressure can go up, and that's why you want to be able to cut back on sodium, because that sodium once the estrogen declines, can create more of a problem with your blood pressure. We'll kind of get into that study maybe next program, next show. But you want to learn as much as you can about your body, fine-tune every part of the picture, because without that, you're not going to have strength and stability. So yes, for initial menopausal symptoms in women, if your DHEA is very low, we might first give you DHEA as a supplement and watch to see if you're getting better levels of estrogen, progesterone, and testosterone, because you can. So if you're early in this, that might be all you need for a few years. And if that is not creating the result over time, then we can give you the bioidentical estrogen, progesterone, or testosterone. For women, a little pellet of testosterone under the tongue. For men, you can do shots, pellet, under the tongue, cream, or even put pellets under the skin for men and women, because that will last about 5 to 6 months. So different therapies depending upon where you are within your loss of the hormones. What do you got, Frankie?
I'm on Reddit. I'm sorry to my Redditors. I almost forgot about you today. I almost forgot. Say, hey, Doc, I've been dragging for months. Low energy, no motivation. A friend did tell me about pellet therapy changing his life. What is the difference between pellets and something like testosterone gel or shots?
So the idea behind the pellets are that once we do the eval and I can figure out what levels of hormone you need, rather than do a weekly shot or a daily sublingual tablet that melts or a daily gel, I can put a series of little pellets after we sterilize and numb the area, right where your love handles are, and place them under the skin so they're there for 5 to 6 months. So you don't need to do much else. We would just place them there so that they would absorb over time and give you the stable hormone levels for that period of time. So it's a great idea. Same thing for women. So for men and women, you can put a little of those on board. For patients that we've already seen that are on shots for testosterone, I need to get an idea as to how much body mass, muscle mass, exercise they're doing to keep that shot putting you in the right position, or if you want to do under the tongue, same thing for the pellets. So we would need to see where you would need to be to feel great, and then that would correlate with how we put the pellets on board.
And we got postmenopausal and struggling with hot flashes, mood swings, and poor sleep. Would estrogen pellets help with that? And are they safer than the pills that are being offered?
Of course. Well, as we typically, as I mentioned a moment ago, I would start with the DHEA and see if you start to feel that your hot flashes are going away. If that works a little bit but not enough, then you can talk about the estrogen progesterone cream, capsule, or pellets. So yeah, it's bioidentical, so they're plant extract. They're not, horse urine like the aforementioned therapy that's been used for years, which may have some risk to it. So pregnant mare's urine is what had been used in the past, but the bioidenticals are far greater and far safer. So it depends upon which road you want to go down. It's relatively straightforward and easy. I still might start with the sublingual testosterone to see where that dose brings you for the first month, and maybe the estrogen progesterone capsule. And if that dose works to put you where we want to be, then we can correlate that into the pellet and put it under your skin.
And we have someone in the chat just saying, my wife started doing hormone pellets and all I've given her is crap, so thank you for clarifying. And I may book an appointment. Well, here is the website.
There's always something interesting that comes out of really good research over years. And the company that we work with is a terrific, highly intelligent group of doctors and people that have put together a great pellet mechanism. So I was attracted to the thoroughness and the nature of how they did things. So that's why I like that. Because think of it, when you're a kid, your body's making the hormones and it's not up and down and here and there and not absorbed, and it's just there. So it's a nice idea to keep it the same idea, same mechanisms you had when you were younger.
All right, back to Reddit. What are the most common side effects people experience with these pellets? I've heard some folks getting acne or mood swings.
Well, that's why as soon as I start to talk about the pellets, I want to see with a sublingual therapy how much testosterone a man or a woman needs to get them to where they need to be. I might start with a capsule of the estrogen progesterone or a shot with the testosterone to see where it puts them. The idea is that you don't want to just randomly put pellets in somebody without knowing where their goal blood level is. So in understanding with their exercise capacity and what their body's going through and their height and their weight, with the capsule or the sublingual, then we can convert that into the pellet. So there's also an algorithm you put a patient's information in, and that also guides you as to how much to use in the pellet. But we typically don't see side effects because you're prepping by doing that. And there may be doctors that don't do that. They just look at you and just start to put the pellets in. That doesn't make sense to me. I'd rather know what levels you need to be at for those hormones. Like testosterone for women should be anywhere between 40 and 50. For men, 600, 700, 800, depending upon their activity level, their muscle mass, and all that. So I'd rather figure that out in a changeable way where I could give you a different dose in a pellet or a capsule. And then once we know the right dose, then convert that over to the pellet.
So we got someone in Rumble just asking, are these synthetic, these pellets?
No, bioidentical. They're made by a compounding pharmacy. And the hormones that we've always used are bioidentical. So it's Mexican yam, wild Mexican yam. Why wild Mexican yam? I don't know. It's just a plant they figured out had a lot of great things in it and a lot of the hormones in it.
That's wild.
That's wild, and it's Mexican, and it's yam.
Yam. We love yam. All right, what else do we got? Chat, this is your chance. I'm throwing this number on one more time. Sometimes we get a few, sometimes we don't, but don't be shy. We're friendly people.
We had a lot of YouTubers today.
A lot of YouTubers.
A couple of Redditors, a couple of Grams.
Yeah, the Redditor situation may have been my fault. I get a text from my wife. You're not looking at Reddit, so thank you.
And TikTokers.
Yes.
Where are the talkers?
Yeah, talkers, not...
When I did the radio show, I would shame people from different areas and say, hey, we haven't heard from anybody from New Jersey today. Then all of a sudden you get inundated with calls from Jersey.
That might be a good tactic.
I didn't hear anybody from Connecticut today. And the show carried, so we would get calls from out west. Ohio had a lovely patient with MS from Ohio. We treated her, and she's been spectacular ever since. But yeah, we have people from all the places. I even got a call on the radio show from a lady in London. And I said, hi, how are you? And I said, Susan from London. I said, oh, London, Connecticut, or London somewhere locally? She said, no, London, England, dear. I said, really? It was so cool. The time is 6 hours ahead. So if that was 8 o'clock in the morning on Saturday, it's probably 2 and change in London. But she had a great question. She ended up coming in. She had a great question. And we were chatting. It was just so cool to hear her accent.
Yeah, it's like a gift. If you're from London, you could lie to me, you could say horrible things to me, but you come off charming, you come off smart, and I
said this many times before. The people that live in Europe, I'm jealous of. Not only because of the cool accents, everything from Scotland, Ireland. You can't understand a lot of that, but Italy, France, Germany, all these places, because you can be in one country and be in the next country in a half hour on a train. You can go to 10 countries if you want. You can just do a lap around and cover all of some of the greatest history, art, architecture, food, more importantly, in the whole world because everything's so close together. Here, what do we have? New Jersey. Don't tell Mike we're ragging on New Jersey today, but it's just...
It's okay. He's from New York. So.
It's amazing to think that you could be in Spain and just go to the next country and see everything they had to offer. I've been there many times, and I love Europe, and I love Italy, and I love France, and I love Spain. I mean, what's not to love? England was great. I haven't been to Scotland or Ireland yet, but I plan to go. I just love seeing how other people live. There was one time I went to, I flew to Geneva with some friends. We met this very charming little old man who I didn't know was a uber wealthy person. He died a few years back, but he owned an investment company, and he picked us up. We went to the UN just to see what it was like because I'd, of course, never been there before. And then we drove into the Loire Valley in France where he had a castle. I didn't know he had a castle. I didn't know nothing about the guy. Cute little guy, schmoozer, well-spoken, well-educated with a little goatee. His name was Bernie. And we get down this beautiful region. It's just gorgeous, and there are flowers everywhere. I mean, something out of, something that Van Gogh would paint. And we go down this one road. I'm like, oh, wow, this is just gorgeous. People just live amongst these flowers. And there was flower fields. You've seen pictures of like lavender fields that are like 1 billion square feet throughout France and everywhere you go. It's just kind of what they do, and they raise these things. And then we come to this castle. I'm like, where the heck are we going? We pull in over this moat thing, and we pull into this big courtyard, and this is where he lives. I was like, my God, people who live like this. And the castle was 1,000 years old, 1,100. Yeah, it dated back to something, 1,100 or something, and it was just surreal. And that's where we stayed for a week. And they had a lot of friends there and people over, and guys and girls. And they had a table that could fit 25 people, and everybody helped make food. And it was unbelievable. I'm like, wow, I'm just living the wrong life. I need to be living here in like the French countryside with all this food and wine. And it was really wonderful. And I went back a few times. But what a place. And walking down in the fields and things, it was just a whole reset, of my brain because, when you work a lot, I was working 6 days a week, and, you're aggravated of one thing or another. But to go there and see this was just incredible. And then on that same trip, we left there and went to Verona in Italy, which is gorgeous, very pastel and old and super gorgeous, You can see it online and you can see it in some of the movies. And at one point, we were eating at a restaurant outside, and it was gorgeous. The prices were nothing compared to New York. Food was the best. I looked over my shoulder, and there's a banner, and it said La Bohème. I'm like, oh, my God, this is 1,000-some-odd-year-old amphitheater in the middle of Verona. And with my friends, I said, my God, I said, the opera's playing tonight. We were there for an early dinner. I said, I've got to be able to see if we can get tickets. I mean, yeah, right, you're going to get tickets the night of the opera. So I walk over to an Italian policeman, Carabinieri, standing by the gate on the side. And in my somewhat broken Italian, I said, any chance we can get tickets? And he goes, looks at me like I'm an idiot. He goes, no.
3 months too late.
No, it's not possible. I said, we're from New York. He goes, what do you want me to do? I said, okay. So I figured that he's a true born Italian. I'm Italian-American. We didn't have dessert at the restaurant. I asked for a takeout box, and I bought cannolis, sfogliatelle. I bought everything you could possibly get, and I got some espresso. And I walk with this big box of pastry. I see him looking at me walking towards him. He's got this funny look on his face. And a few feet away, there was, a big slab of stone, because this thing is built out of stone. I put the box there. I opened it up. I looked over at him. I gave him one of those Italian looks. He looked back at me with an Italian look. And I opened the box, and I pointed towards it. So he made a funny face, came over, looked at me, took a cannoli, ate it, took the espresso, had his shot of the espresso corto, the strong, brought us in, gave us these cushions to sit on because it's a stone amphitheater that goes back, as I say, 1,000-some-odd years. And we sat down, we listened to the opera. And there was an Italian woman sitting next to me, lovely Italian woman. And I'm just blown away about how beautiful it looks and how gorgeous the sky was. It was really the deepest, most beautiful blue with 1 billion stars. And the opera starts, and I'm just sitting with my mouth open. I'm like, and I'm looking around. I don't see any speakers. I don't see any microphones. I'm like,
natural curve.
yeah, okay. So in between one of the songs, I asked the woman, I said, I don't see any speakers. It sounds like she's singing, 5 feet from me. And of course, she explained it was the amphitheater, the way that they designed this thing years ago, because they knew that they were able to create the acoustics there. Completely blew me away again. So, yeah, there's so much you could see just by going a half hour this way, a half hour that way. I mean, it's all the greatest art in the world, so. And food's good, too. So what else do we have? Anybody else?
It's probably a good... People are talking, but they're not asking medical questions. They're excited about your story.
Yeah.
But I'll just say, on that note of you saying, all these people going all these different places and how easily accessible other regions are. It's like when someone told me this, it kind of it's like Italy is literally basically 2 Floridas. So it's like roughly the size of 2 Floridas.
Yeah.
So like, it's amazing that you're able to, every city there is so rich with culture.
And different thousands of years of amazing handed down culture, food, history, respect. I mean, all of these countries are amazing in perfecting and taking care of their history. We're a couple of hundred years old. They're thousands of years old. And you still can't convince me that it was easy to build the pyramids or that it was easy to build the Vatican or any of these gorgeous structures that are all throughout Europe. So it's just art that and ability and talent that you'll never find again. I mean, Michelangelo was 21 when he did the statue of David out of 1 block of granite. How can you, in your mind, see that and start carving it and continue to see that? So it comes out to be the most perfect, I don't know if it's 60 feet high, whatever the size is. It's a perfect statue that's ever been made.
And they say that out of all the pieces of marble, that was like the defected one that they wanted to throw out.
Right. I think Bernini, who was another amazing artist at the time, who did the altar at the Vatican, he didn't like it. He didn't want it, but Michelangelo saw it and said, oh, yeah, that's what I want. I mean, he did the Sistine Chapel. He did so many things. So probably one of the greatest multi-talented artists, in the history of the world. But when you see these things, your first impression is, how did somebody do that? And this is back in 1500. How did they figure this out? How did they do it? Beats me. I'm just grateful for being able to see it. I love the fact that other people have talents, and certainly talents that I don't have, but it'd be amazing to see, you go back in time and see how things were chiseled and made. And some of these, the aqueducts bringing the water down from the mountains into the Colosseum, there's
still
so much.
Working.
Okay. So, yeah, I'll tell one interesting story each time we do the program over different places that I traveled. Thank you for tuning in today. God bless you all. Have an amazing day. You can call the office at 516-794-0404. And the website is drcalapai.com, CALAPAI.com. We'd love to hear from you. Email me through the website, and we'll help you out. Bye-bye now.